Good morning, I am Fruity, Clinical Instructor in Nursing Department from RPIIT. Today we will discuss about vital signs. What are the vital signs? Temperature, pulse, respiration and blood pressure are the vital signs. These are also called as cardinal signs. They reflect the body's physiological status and provide information about the person with current condition or state of health. The frequency of vital signs assessment depends upon the person's condition. The more critical the patient condition is, more often these signs are needed to be taken and evaluated. When to assess vital signs? On the patient admission, during physical examination, before and after any invasive diagnostic or surgical procedure, monitoring during recovery, before and after medications that affect cardiovascular or respiratory function, in any emergency medical condition. Body temperature. Body temperature is the balance between heat produced and heat lost by the body. Heat production in the body is called thermogenesis. Heat lost to the environment is called thermolysis. Fever. Body temperature above than normal is called as fever or hyperthermia. The person having fever is indicated as febrile. Fever can be categorized in different ways: low grade fever, high grade fever and hyperparexia. Low grade fever above 37.1 degrees Celsius but below 38.2 degrees Celsius. High grade fever above 38.2 degrees Celsius. Hyperparexia higher than 40 degrees Celsius. Intermittent fever, alternate febrile episodes with periods of normal temperature. Remittent fever, continuous fever but variations throughout the day. Methods of measuring body temperature. First one is oral method, second one is rectal method and third one is axillary method. Pulse. The pulse is an index of the heart rate and rhythm. Pulse provide valuable data about the person's cardiovascular status. Definition: the pulse is a wave of blood created by contraction of the left ventricle of the heart. Site of monitoring pulse. There are 9 sites where pulse can be commonly taken. These are temporal, carotid. Third one is apical, brachial, radial, femoral and dorsal pedis. Respiration. Respiration is the process of bringing oxygen to body tissue and removing carbon dioxide from it. The lungs play a major role in this process. Respiration is the act of breathing which refers to two processes: external respiration, internal respiration. Normal respiration is autonomic, effortless and regular. The normal adult rate of respiration is generally ranged between 14 to 20 breaths per minute. How to take respiratory rate? Place the patient arm in relaxed position across his abdomen and place your hand on the patient arm. Now observe complete respiratory cycle, inspiration plus expiration. Like this one. Some terms of respiration: tachypnea, bradypnea, apnea and hyperapnea. Okay? An increased respiratory rate more than 24 breaths per minute. Okay, this is known as tachypnea. Bradypnea, a decreased respiratory rate less than 10 breaths per minute. Apnea, total cessation of breathing or respiratory rate. Hyperapnea, increase in the depth of respiration. Blood pressure. Now we will discuss about blood pressure. Blood pressure is the force exerted by the blood against the vessel wall, that is arterial wall, which is measured in millimeter of mercury. Blood pressure measurement includes systolic and diastolic pressure. Systolic pressure, the maximal pressure exerted on the arteries during contraction of the left ventricle of heart. Diastolic pressure, the amount of pressure exerted on the arterial wall with the ventricles at rest. Methods of measuring blood pressure. Direct method. An oscilloscope is used for this method. This is a continuous method which is measure mean pressure. A needle or catheter is inserted into the brachial, radial or femoral artery and oscilloscope displays arterial pressure in a waveform. Indirect method, taking blood pressure by using sphygmometer. Following types of measuring devices available: mercury manometer and Android manometer, electronic BP device. Normal blood pressure is an adult varies between 100 to 140 mm FHG systolic and 60 to 90 mm of Hg diastolic, but BP may vary widely depending